So, before we start the questions, tell me a little bit about yourself.
My name's Clementine. I'm from Los Angeles. I'm currently a student at UCLA right now. I love writing. I'm 21 years old as well.
What are some of the health problems that you experienced while you were on treatments and after surgery? And I know that's probably a tough question, but thank you for talking about it.
Yeah, of course. Obviously, I dealt with a lot of complications from being on puberty blockers before I hit puberty. I have constant joint pain and bone density loss as well. They didn't explain to me the potential lifelong consequences.
Did it feel like you were leading the process? Or did it feel like someone or someone else were leading you in the process?
I started seeing a guidance counselor at my school. She started telling me, you might be suffering from gender dysphoria.
Imagine you're a parent. Your child's therapist tells you your daughter is hurting, and the only way to make her well is by changing her gender. Hormone therapy, experimental surgeries, otherwise she'll hurt herself or worse. You're asked, would you rather have a living son or a dead daughter? That's what happened to Clementine Breen and her family when she was in just the 8th grade, and they're not alone. Every year, American families are misled by activists, physicians, and mental health practitioners into making the biggest mistake of their child's life. They are betrayed by children's hospitals and medical associations. These are the very institutions we should all trust. How does this happen? Through a potent combination of twisted political ideology, social pressure, and most upsetting, greed. I'm Dr. Brian Christine, and the following testimonials will shine a light into this dark world of deception, medical malpractice, fraud, and stolen innocence.
Pediatrics is the lowest paid medical specialty, and when you think about healthcare for children, very often kids need sort of a one-time treatment for an acute problem. Well, the pediatric gender clinic model promised to elevate their prestige. What sex-rejecting procedures do is they take kids who are physiologically and medically healthy and make them dependent upon the healthcare system, very often for life. It's a sort of captive patient model that allows for continuous generation of revenues. Estimates range between $25,000 and $75,000 per patient. These generate enormous profits for hospitals.
So I first began to question my gender identity when I was 11 years old. At the time I was going through puberty. I hit it a lot earlier than all of the other girls in my school, and it was really difficult to deal with. September of 2017 is when I had my mastectomy. The surgery was referred to with watered down terms such as top surgery. So when I got to 17 and realized, oh, I am gonna make it, I did a lot of introspective thinking, and I was just like, this isn't how I want to live my life. It feels like I'm putting in a lot of effort to try to maintain this facade that I'm a real boy. The testosterone really damaged my liver at 14. I have genital atrophy. I have urinary issues. It's almost like I'm a menopausal woman. What I wasn't told was that among the complications would be nerve pain, which I deal with every day. It sometimes feels like slicing or like an electrical zap. I also was not made aware that I would be left with mammary glands. So if I were to get pregnant, I would likely produce some milk, but it would be trapped with no way to get out and cause serious infection. So I was kind of blindsided by these things a bit. My doctors kind of did whatever they felt like.
Unfortunately, stories like Layla Jane's aren't just shocking, they're big business. Initial procedures for sex-rejecting surgeries can cost over $100,000 each. It's a $1 billion a year enterprise, even by conservative estimates. The state of Pennsylvania alone was charged $76 million by gender clinics for just puberty blockers for patients aged 18 and under. Over 4 years, they saw reimbursement for puberty blockers increase by more than 2,000%. Hospitals' flagship programs report multi-million-dollar billings. And what began as a handful of specialized clinics 15 years ago has grown to over 225 nationwide. How did this happen? Well, the answer might surprise you.
I was 17 when I first was prescribed testosterone and had my first injection. I'm 23 now, and I'm about 3 months off of testosterone, and I'm still trying to pick up the pieces. If I knew about the long-term health issues that I was going to be experiencing, I would not have started the hormones in the first place. It was a lot of fatigue, brain fog, issues sleeping, issues with diet. My thyroid was just destroyed. Once I was done dealing with the side effects of testosterone and decided to detransition, the clinicians and providers at the hospital just gave up on me. I feel like the system betrayed me.
Everything changed after the meeting with the social worker at Children's Hospital. My son was 14 years old when he handed me a piece of paper that said, "I think I'm trans." He was influenced online, but it was confirmed when that Children's Hospital therapist told him he was right. Right after that appointment, my kids started acting really suicidal. My life stopped completely. Our house turned into a suicide watch. We were failed by our doctors, by the health insurance company, by the therapists.
I had a lot of issues at home, and I had been sexually abused. I had met with a gender therapist, and they had told me that I was most likely transgender. I was not fully informed of the risks of taking testosterone. I had a seizure. My vocal cords thickened, and I have issues going to the restroom. There's no way to reverse that. When I was detransitioning, I definitely felt abandoned by the healthcare industry. The system treated me like an experiment, and it didn't work. If I could talk to my 13-year-old self, I would tell her that you are beautiful just the way that you are.
So what we found is that for many of these patients and families, they're immediately railroaded down a pathway that pushes them into very rapidly and quickly embracing and accepting these irreversible sex-rejecting procedures. Many medical providers, many hospitals and clinics providing sex-rejecting procedures decided more or less just to lie about what they were doing. We were shocked to find that another common misclassification, another false diagnostic code, is a condition known as precocious puberty. This is a child who starts puberty at an abnormally young age. These false diagnostic codes were used not just to circumvent difficulties getting insurance reimbursement, but in states that had state laws that prohibited sex-rejecting procedures in minors, this false diagnostic coding was actually used to circumvent state laws as well.
It's not just our children paying, or our families, or even the insurers. Our findings show that false diagnosis coding for puberty blocker prescriptions has led to over $47 million in fraudulent billing. It's a cost borne by both public and private insurance. In the end, it's paid for by you. But how did this happen? How did this culture of fraud and deception spring up right under our noses? Profit, pressure, and politics.
Under the Biden administration, starting with an executive order about this issue and then continuing with various actions from various administrative state departments, there was a strong and consistent push to try to get coverage for sex-rejecting procedures, to get them paid for by various insurance companies or government entities or other benefits programs. So there was a strong push also from key personnel in the Biden administration. Admiral Rachel Levine at the Department of Health and Human Services, for example, leaned heavily on some of the professional medical societies, like the World Professional Association for Transgender Health, to actually lower their recommended age requirements for certain intervention to do these sex-rejecting procedures on younger and younger individuals.
At the end of the day, you need to be able to discern between enabling and helping. That you giving me access to certain drugs, that you just giving me referrals to whomever I asked for didn't help me heal. It affirmed me in my delusion. I began identifying as transgender at age 11, started hormone replacement therapy at age 17, and by age 19, I had a double mastectomy. I could not have wrapped my head around what it would be like for them to cut my incisions back open and manually drain blood clots from my chest cavity until I lived through that, until I was on that hospital bed having it happen to me. At the time, I thought I was gonna die. Nobody will understand the complications that come with these procedures and these treatments until you experience them.
Millions of dollars spent, hundreds of thousands of families misled, medical best practices rewritten or cast aside to serve this new agenda. So what have we got to show for it? Parents were promised happier, healthier children. Instead, the results are horror stories. Young, vulnerable patients steered toward life-changing procedures by a system created to increase revenue and serve an ideology, not their health. And when they questioned their treatment, when they stood up for themselves, that system abandoned them.
I wish doctors showed the same compassion to me now that they did when I was originally transitioning.
I was just kind of left aside and cast away after detransition.
A child, I don't think, is capable of knowing whether or not their future lifestyle is going to be aligned with motherhood or fatherhood or parenthood in general.
As much as I wish I could go back, I can't.
I don't want to see more kids be harmed and come out the other side living the way that I do.
More stories like these are finally being told, and the full scope of this horrifying scandal is now on full display. But there's still more work to be done. As of this moment, very few of the bad actors responsible for harming our children have ever been held accountable. That's a job for the American government and a job for the American people. The system failed to protect our most vulnerable children. We must not fail them again.
I think that our leaders should be making sure that doctors and institutions are not taking advantage of adolescents' insecurities to make money, but are actually listening to those insecurities and doing the best that they can to help them without harming them.